You've definitely heard the name, right? Ozempic. It's been all over the headlines of this game-changing drug for diabetes and weight loss. But with all that buzz, it's really important to get a clear, honest picture. So today, we're going to cut through the noise and break down the potential side effects from the really common ones to the super rare ones, all based on the actual clinical data.
So you see all the before and after pictures, you hear all the stories, but what is actually happening inside your body when you take this stuff? Because understanding how it works is the absolute key to understanding all of its effects, both the good and, well, the not so good.
Okay, let's dive right in. Before we can even get to the side effects, we gotta cover the basics. What even is Ozempic, and how does it do what it does?
All right, so at its heart, Ozempic is a prescription medicine. The active ingredient is a word you'll hear a lot, semaglutide. Now, its official FDA-approved job is treating type 2 diabetes, but as you know, it's become hugely popular for weight loss. That's what we call off-label use. It's part of a whole class of drugs that basically mimic a hormone your body already makes.
So how does it pull this off? Well, it's kind of like a three-pronged attack. First, it gives your pancreas a little nudge to release more insulin right when your blood sugar gets high. Second, and this is a big one, it hits the brakes on your stomach, slowing down how fast food leaves it. That's the secret sauce for why you feel full for so much longer. And third, it sends a little message to your liver to, ease up on producing so much sugar. This triple whammy is what makes it so powerful, but as you're about to see, it's also the exact reason for most of the common side effects. So, since this drug's main stage is your digestive system, it probably won't surprise you that the most common side effects are all about your gut. This is what most people can expect to feel, especially when they're just getting started.
If you look at the actual numbers from the clinical trials, nausea is the clear frontrunner. We're talking about 1 in 5 patients feeling it. After that, you've got vomiting and diarrhea, though they're quite a bit less common. And remember, this isn't random. It's a direct result of that whole slowing down your stomach thing we just talked about. Your body is just adjusting to a new pace.
And it doesn't stop with those top 3. You might also run into some abdominal pain or constipation. And then there's this one, decreased appetite. Now that's kind of funny, right? Because for weight loss, that's sort of the whole point. But it's listed as a side effect because it's such a big change for your body. Feeling tired or getting headaches is also pretty common while your system is getting used to the new normal.
But here's the really crucial part. Some good news. For most people, this stuff doesn't last forever. It's usually at its worst right at the beginning or when you up your dose. Then, over time, your body tends to adapt and things calm down.
Okay, let's talk about something you've probably seen all over social media, Ozempic face. It sounds a little scary, like the drug itself is doing something weird to your face. But the reality is a little more complicated than that.
So let's just clear the air on this one. The myth is that the drug itself is directly changing your facial structure. That's not what's going on. The fact is, when you lose a lot of weight really fast, you lose it from everywhere, and that includes your face. When the fat that gives your face volume shrinks, you can end up looking a bit more gaunt or aged. It would happen with any kind of rapid weight loss.
And this doesn't happen to everyone in the same way. It tends to be more noticeable in women over 40, people who drop a lot of weight super quickly, and folks who just didn't have a lot of facial fat to begin with. So at the end of the day, this isn't about Ozempic's chemistry. It's all about the speed of the weight loss.
Okay, we need to shift gears for a minute and talk about the more serious potential side effects. Now, it's really important to remember that these are rare, but being aware of them is absolutely essential for anyone taking this medication or even just thinking about it.
And this isn't just chatter, this is official. Ozempic has what's called a boxed warning from the FDA. That's their most serious type of warning, and it's reserved for risks you really need to pay attention to. So let's look at exactly what those are.
I know a list like this can look pretty intimidating, so let's just walk through it. The risk of thyroid tumors. That was mostly seen in animal studies, but the warning is there for humans just to be safe. Pancreatitis, which is a painful inflammation of your pancreas, is another one. Then you have gallbladder problems, kidney injury, which can sometimes be linked to getting dehydrated from all the vomiting and diarrhea, and of course, severe allergic reactions. And finally, hypoglycemia. That's when your blood sugar drops too low, which is a bigger risk if you're already on other diabetes meds.
Now, the whole point of knowing all this isn't to scare you. It's to empower you. It's so you can have a really smart conversation with your doctor. For example, if you or your family have a history of a specific kind of thyroid cancer called MTC, this drug is pretty much a no-go. Same goes if you've already had kidney or pancreas issues. These are the critical things you absolutely need to talk about. So, with all of this information, how can you actually manage the experience? Let's get into the practical, actionable stuff. What you can do to make things easier, and when you absolutely have to pick up the phone and call your doctor.
Think of this as your little toolkit for getting through those common side effects. Doctors are smart about this. They'll usually start you on a really low dose and then slowly increase it over weeks. This gives your body a chance to adjust. Taking your shot with a small snack can really help with nausea. Staying hydrated is so important. And if you're feeling totally wiped out, listen to your body and just get some rest.
And this next part is non-negotiable. There are some symptoms that mean you need to get medical help right away. We're talking about severe, intense pain in your stomach. That could be a sign of pancreatitis. Or if you start swelling up, get a crazy rash, or have trouble breathing, those are classic signs of a bad allergic reaction. Don't wait on these. Get help immediately.
So at the end of the day, it really all boils down to this one question. Ozempic can be an incredibly helpful medication. The benefits can be huge, but it's not risk-free. The goal here wasn't to tell you what to do, but to give you the clear, straightforward information you need to go and have a great conversation with your doctor, and together, make the best choice for your health.